I'm Maggie Weiss, and this is my bone video.
This is a left clavicle, and this is the sternal or medial end, and this is the acromial or lateral end. This is a posterior view of the left scapula. This is the medial border, the lateral border, the superior border, the superior angle, inferior angle, the glenoid fossa, the spine, the acromion process, the coracoid process, the supraspinous fossa, the infraspinous fossa, and then if you flip to the anterior view, you have the subscapular fossa and the suprascapular notch. This is a left humerus in the anatomical position. You have the head, the anatomical neck, the surgical neck, the greater tubercle, the lesser tubercle, the bicipital groove, the deltoid tuberosity, the medial epicondyle, the lateral epicondyle, the trochlea, the capitulum, the radial fossa, the coronoid fossa, and then if you flip it, you have the olecranon fossa. This is a left radius in anatomical position. This is the head, this is the neck, this is the radial tuberosity, and this is the styloid process. This is a left ulna in the anatomical position. You have the trochlear notch, the radial notch, the coronoid process, the olecranon process, the head, and the styloid process. This is a right hand in anatomical position. You have the carpals, and an easy saying to remember them is some lovers try positions that they can't handle. So you have the scaphoid, the lunate, the triquetral, the pisiform, the trapezium, the trapezoid, the capitate, which is also the keystone, and the hamate. Then you have the metacarpals that are labeled 1 through 5, lateral to medial, so 1, 2, 3, 4, 5. And then you have the phalanges that are also labeled lateral to medial, 1 through 5. And you have a proximal, middle, and distal, and the thumb only has a proximal and a distal. These are some loose hand bones. This is a scaphoid, and you can tell because it has an almost S shape. This is a hamate because it has the hammerhead. And this is a pisiform because it looks like a P. This is a left pelvic bone. You have the anterior superior iliac spine, the anterior inferior iliac spine, the posterior superior iliac spine, and the posterior inferior iliac spine. Then you have the iliac crest, the iliac fossa, the acetabulum, the ischial spine, the ischial tuberosity, the ischial ramus, the superior ramus, the inferior ramus, the pubic symphysis, where the two pelvic bones join, the obturator foramen, the greater sciatic notch, and the lesser sciatic notch. This is a left femur. You have the head, the neck, the greater trochanter, the lesser trochanter, the intertrochanteric line, and on the posterior side you have the intertrochanteric crest. You have the gluteal tuberosity, the linea aspera, and then you have the lateral epicondyle and the medial epicondyle, and then you have the lateral condyle and the medial condyle, and the patellar surface and the intercondylar fossa. This is a right patella, and you can tell because if you lay it down it falls to the right, and this is the apex and this is the base. This is a left tibia. You have the lateral condyle, the medial condyle, the tibial tuberosity, the intercondyle eminence, the anterior crest, or what we call the shin, and the medial malleolus. This is a left fibula. You have the head, the neck, the shaft, and the lateral malleolus. This is a right foot. You have the tarsals, you have the calcaneus, the talus, the navicular, the cuneiforms, there are 3 of them, and the cuboid. Then you have the metatarsals, which are labeled medial to lateral 1, 2, 3, 4, 5. And then you have the phalanges, which are labeled medial to lateral. And like the hand, you have a proximal, middle, and distal. And the big toe only has a proximal and a distal. These are some loose bones of the foot. You have the calcaneus, which also forms the heel. You have the talus, and you have the navicular, and it looks like a boat.
Thanks for watching. Hope you learned a lot about the bones.